Okay, this video is what causes hypertension. The main purpose of this video is for people with hypertension to know all the different things that they can do to get better. And there's some obvious things that can be done. I just show you a picture of this textbook. This is the Harvard textbook, Pathophysiology of Heart Disease. They really ought to name it, How to Lie to Patients and Make Sure They Never Get Better. The book is totally stupid. You should not respect Harvard. You should not respect the Ivy League medical centers. For most things, for chronic disease, they stink. They stink bad because they've sold out to the big drug companies. I've talked to medical students recently, and they're telling me they're still being taught 95% of hypertension is of unknown cause. That is complete nonsense, 100% nonsense. And I'll show you why here, just so you know. And I can also tell you why is this happening. Because the United States academic system of colleges and medical schools, graduate schools, has sold out to the new religion of atheistic Darwinism. Once you don't believe in God and have that moral foundation that He's created in the image of God and intrinsically valuable, and that you're obligated to tell the truth, then you have no obligation to the stupid patient. The patients are a bunch of poor people. Most of them are stupid. They don't know anything of what's going on. It's very easy to abuse them and rip them off. So you have to care about them just for the sake that they're people. Otherwise, they get abused, as they currently do. And here's an example of the truth. Blood pressure in the African native. It's a paper from the Lancet Journal, 1929, author C.P. Donison. 1,800 consecutive adult patients admitted to the hospital, and all their blood pressures were checked. Not a single patient was hypertension, 0 out of 1,800. And these are black patients, black adults in Kenya, okay? In the United States, if you check the blood pressure on 1,800 adult black patients, you probably have hypertension in about 80% of them, maybe more than that. Okay, so anyways, also they checked the blood pressure of the average 60-year-old Kenyan patient versus European. The average Kenyan, 60 years of age, well, first of all, the average European at that time in 1929 was mildly hypertensive with a blood pressure of 140/90. The average Kenyan was 105/67, okay? Fantastic blood pressure. The blood pressure never changes from, teenage years to elderly. And you get the same thing in other plant-based populations. That they don't get hypertension, the Yanomamo, the Tarahumara, and a whole bunch of other plant-based populations. Okay, so what causes hypertension? I'm going to show you some more pictures to explain the physiology of it in just a moment, but I want to give you this list here. So somebody who's got hypertension, they want to get better, they can be aware of this list and it can help them. So first of all, fat is the obvious most important cause. High-fat diets cause hypertension, okay, because they make the red blood cells stick together. The reason you have a blood pressure is to pump blood to the top of your brain, your cerebral cortex. You have to pump that blood against gravity. The need of the cerebral cortex at the top of your brain guides blood pressure, okay? So it gets enough oxygen, gets enough glucose. So when you're pumping thick blood, you're pumping a milkshake up to the top of your brain instead of normal blood that's like water. So pressure has to go up. When you have high dietary sodium, sodium is a vasoconstrictor, inhibits endothelial nitric oxide synthase. So you lose your vasodilator, and then you're pumping through narrowed arteries, so pressure has to go up. The plant foods, by the way, do just the opposite. Sodium is mostly high in processed foods. When you eat plant foods, P for plant, P for potassium. Potassium is a major vasodilator. So is magnesium. That's what you get from plant foods. So the good stuff's in the plant foods. The bad stuff is in the processed food. It's very high in sodium. Meat is also often high in sodium because people use sauces that are high in sodium. It's often preserved with sodium. So you don't win going down that path. And meat is very high fat. Okay, next thing is just being fat, obese. Now, UPF means ultra-processed foods. Those things are typically loaded with MSG, MFG, glutamate. High-fat diets also make people fat. Rebound hypoglycemia can make people fat. Diabetes, the disease itself, and diabetes medications will have a tendency to lead to obesity. And I'm talking about type 2 diabetes here. I'm going to go through medications later in this list here. So those are some of the things that make people fat. The MSG, MFG, fried foods, they make the food hyperpalatable and adding salt to it as well, and people tend to overeat. Over time, omega-6 cooking oils damage the brain hunger center, and people have more difficulty controlling their appetite. So again, same old answer. Best diet, low-fat, low-sodium, vegan with no oil. Okay, next point, estrogenic, and also single ingredient foods. The more you process a food, the more likely it is to cause weight gain in general. Okay, estrogenic chemicals, they're associated with weight gain. If you don't eat enough dietary fiber, your body, normally tries to excrete excess estrogen through the liver into the bile that you defecate out of your body. But it's conjugated by a chemical, glucuronic acid, in the liver. If you don't have dietary fiber, then you get bad gut bacteria, and they have more of an enzyme, glucuronidase. They will cut the bond between the connection between the glucuronic acid and the estrogen, and that'll cause the estrogen to be reabsorbed into your body. So that's bad, all right? Also, there's a lot of estrogens in tap water, so you want to filter your water. At a minimum, have a carbon filter. That'll remove the estrogenic chemicals, okay? I also like to have a reverse osmosis filter for your drinking water, cooking water, because the F- in there, it kills the good gut bacteria. So does the chlorine in there. So does the Al that they put into tap water, okay? A lot of bad stuff in tap water. Next thing, and the chlorine will also be taken out by the carbon filter. Okay, leaky gut. Leaky gut leads to a lot of problems. You get bacterial endotoxins into your blood. Those cause what's called amyloid clotting. I give an entire lectures on that, so I'll go into that in those lectures. You also get a generalized systemic inflammation. Basically, bacteria and bacteria toxins get across your gut barrier, and then they drive the immune system crazy. Your white blood cell count goes up, dealing with all the inflammation and bacterial toxins. You get activation of neutrophils that causes netosis. It's prothrombotic. So all these things thicken the blood, increase hypertension, increase atherosclerosis. Psychological stress will increase your blood pressure, and also stress equivalents. So stress equivalents are sleep deprivation, caffeine, corticosteroid medications. And also those stimulant medications like attention deficit medicines. Those are stimulants, man, like amphetamines. It's a stupid drug. People should not be taking that stuff. Okay, next, other medications that can cause hypertension. Now, here's what's funny. People go for psychiatric illness as psychiatrists, and they're given these psychiatric medicines. Look how bad these medicines are. Selective serotonin reuptake inhibitors, SSRIs, antipsychotics, benzodiazepines, and lithium. The best psychiatrists who ever lived, people like Peter Breggin, they say that all psychiatric drugs cause a lobotomy. The antipsychotics cause it pretty fast. The other drugs do so more slowly. So the drugs make people stupid. And guess what? They also tend to make them fat. What a wonderful thing. You go take a pill to make yourself fat and stupid. I've noticed a pattern here too. A lot of drugs that cause people to gain weight, they're often mitochondrial inhibitors. Now that's not all of them, and that's not always true, but it's often true. Epilepsy drugs, they're often mitochondrial inhibitors, okay? And they make people stupid, they lower IQ, and they also increase the tendency to weight gain. Not good. A lot of diabetes medications, including insulin, tend to make the patients gain weight, become fatter, which makes it harder to control their diabetes. Brilliant strategy. It's good strategy for the drug company. OCPs, oral contraceptive pills. Don't get me wrong. Sometimes people need insulin. They got type 1 diabetes, etc. But the point I'm saying is most type 2 diabetics, if they just get their diet together early, they can reverse the condition. Okay. OCPs, oral contraceptive pills, estrogenics, typically associated with weight gain. We talked about corticosteroids causing weight gain. Some ARVs, antiretroviral medications, will cause weight gain, tend to cause weight gain. Okay, the next thing is a loss of the dietary nitric oxide pathway. NO is nitric oxide. You get them especially from eating greens, plant nitrates. They come packaged with antioxidants. That's why the nitrates in greens are good. The preliminary nitrate is NO3. I'll show you a picture in a sec, but in the mouth, the bacteria in the back of the tongue convert it to NO2 nitrite, and in the stomach acid converts it to nitric oxide, and then it goes into your blood. You get systemic vasodilation because nitric oxide is a vasodilator, opens up arteries. The problem is if your toothpaste or your mouthwash have F- in it, that'll kill the bacteria on the back of your tongue, and then you won't be able to take that conversion step from the original nitrate to nitrite in your mouth. If you got stomach acid blockers like PPIs, proton pump inhibitors, then you're not going to get the last conversion step where you go from nitrite, NO2, to NO, nitric oxide. So all these things will cause hypertension, can cause hypertension. Loss of sunshine. Sunshine is good for you. It releases nitric oxide precursors from your skin. Also helps generate vitamin D, which helps you have a better blood pressure. And it helps with sulfation of the endothelial glycocalyx. Okay, so that's the big summary. So the point is there's a lot that a person can do. And we know that these things can cause hypertension. So why not just avoid them? They don't teach this to medical students. And this has been this way since I remember back when I was a medical student, 100 years ago. And the same thing today to the patients. I've been a doctor over 30 years, by the way. They don't teach the medical students. So over 30 years goes by, all right, and they still don't teach the students what to do. That's pathetic. It's a disgrace. See, the average person's so clueless and stupid. They think these Ivy League famous medical centers are out there to help them. No, they're not. They're trying to rip you off. They're not your friend. Don't get me wrong. They're good for some things. Acute care, emergency room often does a lot of good things. And there are some other good things the medical system does. And a lot of doctors do know a lot and want to help their patients. But the system itself is designed to rip off the patient and make sure they never are cured of chronic diseases, because you can't cure dietary diseases with a pill. Okay, this is some stuff I talked about, just going into more details. I could have a whole bunch of lectures on hypertension. This was sort of a quick summary. Here's the Windkessel effect. If you're chronically hypertensive for a couple decades, you lose all the elastic fibers in the ascending thoracic aorta, so you lose its elastic recoil that occurs during diastole, left ventricle relaxation, so you can't generate diastolic flow, and then the body compensates by increasing systolic flow. We talked about red blood cells having a zeta potential, negative charge on their outer surface, bridging molecules sticking them together, like LDL cholesterol, triglycerides, chylomicrons, IgM antibodies, fibrinogen clotting protein, uric acid, and that being associated with hypertension. This is just the red cells stuck together by the bridging molecule. This is just showing that at peak lipemia, you're decreasing oxygen delivered to your tissues, and you get cardiac angina. In patients with cardiac angina, that's when they become symptomatic. This is just showing the Kempner diet, how putting the patients on a low-fat, low-sodium vegan diet, he just cured tons of hypertension patients. Here's the nitric oxide cycle we talked about. Bacteria on the back of the tongue make the first step to convert NO3 to NO2. This should say nitrite. Okay, and then in the stomach acid converts the NO2 to NO, nitrite to nitric oxide. Okay, and then here's the medications that mess it all up. F- in toothpaste, or F- in water, PPIs, antacids, because you need that stomach acid for that last conversion step. We talked about leaky gut. Normal gut over here with intact tight junctions, leaky gut with a loss of tight junctions. And then bacteria come in, bacterial endotoxins come in, the immune system overreacts, white blood cells go up in the blood. White blood cells are big, typically twice the size of a red blood cell. RBC is about 7 microns. Capillary is smaller than that, 5 microns. Whereas a typical WBC white blood cell is a neutrophil. It's about 65% of your white blood cells. And they get elevated with, when you got leaky gut, to deal with all these bacterial toxins and bacteria getting into the blood. So now you're pushing these big honking neutrophils, 14 micron diameter, twice the size of an RBC through your capillaries. Pressure goes up. Plus they're undergoing netosis. This is just the idea of gram-negative endotoxins getting in with leaky gut. I also had a diagram about estrogen. I don't think I included it here. This is just showing that the neutrophil is twice the size of a red blood cell, 14 microns versus 7 microns in diameter. So harder to push big cells through little capillaries. This is just a neutrophil that's been activated and is trying to fight an infection. And so it'll actually commit suicide in a sense. It throws its DNA outside into the extracellular space. This is called netosis, neutrophil extracellular traps. These are quite prothrombotic, and they contribute to causing hypertension, and they form a scaffold for thrombosis. Not good. You don't want that happening. High-fat diets make that more likely. So does leaky gut. So anyways, that was just a quick refresher. And the key slide was that one where I gave all the list of things that cause it. So somebody with hypertension can go through that list and avoid all those things and have a good chance to dramatically improve their blood pressure. They got to work with their doctor, because if they're on meds, they'll drop their pressure too low and they could pass out. So they have to work with their doctor. But at least it's good to know what options you have to try to get better.